Hello everyone, I am Dr. Mona Parmar and welcome to my channel Homeonist. So today I am not going to talk about any homeopathic medicine. Today I am going to talk about a diagnosis, and that is osteopenia and osteoporosis. Now this term osteopenia you must have heard, or probably you must not have heard, because it is something which is literally blind symptom. Nobody understands this symptom. Nobody is able to understand what is happening in this. So osteopenia and osteoporosis, basically they are type of loss of bone density. So now osteopenia being something very mild and osteoporosis which is little severe. Now you must be wondering, what is this? What is basically osteopenia? And why are we so much bothered about it, and why we should be aware about it? So now understand one thing, that your entire body, basically we have a bony structure, we are made of bones. Our bones are generating new bone only till a particular certain age. So as you know that there is a bone growth. In children the bone grows and it happens only till the age of 16-17. That is the only time the bone is growing, till that particular age. Later on the bone is basically losing its density over a period of time. Now when it comes to females, the bone density or the loss of bone density or the mineral density which we talk about gets lost when the female attains a menopausal stage. Now why does this happen? Because at menopause there is loss of calcium, there is no loss of minerals, there is hormonal imbalance, and that's the reason why females tend to develop osteopenia and osteoporosis at that particular age. But it is not that a female can become osteopenic or osteoporotic after menopause only. Why? Because nowadays we are living a very bad lifestyle. We are eating very I can say non-nutritious food. Earlier people were eating nutritious food, and that's the reason why you can see our grandmothers who have lived up to 90, 91, 95 years of age. Why? Because their bone density, their bones were very strong. And why did that happen? Because of good food, good diet. There was no junk, nothing at all, no preservatives. Whatever they were eating was something which was very nutritious. So coming back to my point is that osteopenia and osteoporosis. Now if we want to know exactly what is osteopenia and what happens in osteopenia and osteoporosis, so the person, the female or a person who is going through osteopenia will get lot of bony pains. So basically bony pains are throughout the body. They will not be a particular bone or a particular joint which will be affected. It will be throughout their body. So the person might say, or the female might say, that even if I am sleeping the whole night, the next day morning I feel unrefreshing and I start getting body pains. My entire body is paining. I don't feel that I have slept. I feel I have slept on a rocky bed. So I keep on getting pains. And why do I get pains? I don't understand. Sometimes I'm getting pain in my shoulder, sometimes I'm getting pain in my wrist, sometimes I'm getting pain in my fingers. I'm not able to understand why so. I'm eating properly, everything I'm eating, I'm drinking milk, everything is happening, but still I'm getting pains. What is the reason? So people think about vitamin D deficiency, definitely, calcium deficiency, definitely, that is there, but nobody does a DEXA scan. A DEXA scan is a bone density scan. Now, what exactly or how exactly a DEXA scan helps? So, I had a patient who was getting back pain constantly, at age of 65, and she was constantly getting back pains. I used to treat her for few days. She used to become better. Again, after 2-3 months, again she used to come back with the same back pain. So this kept on happening. And then one fine day I told her that, why don't you get your DEXA scan done? She said, what is that? I said, it's a bone density scan which helps you to understand exactly how are your bones functioning or how are your bones at a present condition. So basically in that scan it came out that her density had lowered down to a particular level where she was at a high risk of fractures. So when the density of the bone becomes very less, the bones, in, if I say in a lay person's language or in a common language, they become very soft and they tend to become brittle and they tend to break. So even that person has a small fall or a small trauma, she would land up in a fracture. Why? Because that bone has become very brittle. It can break any moment. So when her DEXA scan was done, that revealed that her density had gone down very low, and that's how where we started with some supplements, and that's how she started becoming better, and now she is pain free. So it's not that the person cannot become pain free even with osteopenia and osteoporosis. The patient can become pain free. Only thing is that sometimes some investigations are mandatory and they will help you to understand and diagnose that you are suffering from a particular illness. And that's how things become smoother, and that's how people will understand that they are having a particular disease, and then they can take some action. Unless and until you don't investigate yourself, you will not even understand what is happening to you. So I would recommend all my patients, all people who are watching this video, if you are above 45, 50 and if you are getting bone pains, please get a DEXA scan done. It can be done at any imaging center where CT scan or PET scan or MRI, such scan centers, they do a DEXA scan, and it is not supposed to be, you are not supposed to get scared of that scan. It's a very simple scan. It will take hardly 5 minutes to undergo that scan. So please go and get this scan done and understand what is your density, understand what is your score, so that you can ask your doctor to take the necessary steps for it. Thank you so much for watching this video.